Good morning, colleagues. We're going to tell you a bit about our picture of the CEPN development as it stands in London and across the country. We collectively think that the CEPN movement is the answer to a lot of problems in the NHS at the moment. There's evidence that training hubs, CEPNs as they're described, can bring about productivity gains, better access to primary care, a better range of services to patients, and solutions to an awful lot of problems that are out there.
What I shall try to do today is to try and describe what a community-based educational provider network is and how it may function. About 2 or 3 years ago, some of us came to the view that community-based education does not have a voice within workforce planning and development. And as a consequence, we envisaged the development of these networks which bring together providers from differing parts of the health and social care economy. So we have a number of CEPNs across the whole of London and Kent, Surrey, Sussex. Each CEPN is made up of partnerships which bring together providers from primary care, secondary care, social care, as well as from the higher education institutions. The intention is that these partners working together will begin to have a better understanding of the needs of the population and how they relate to the needs of the workforce within a local borough. So many of the CEPNs provide educational services and workforce planning for borough level populations. As a result of the work of the CEPNs, we have seen an explosion of interesting and innovative practice in education and training arising. And for the first time, we're beginning to see the development of the workforce aligned to the needs of our local populations.
I'm the Programme Manager for CEPNs for South London. Most likely you will have most of your dealings with me on a day-to-day basis if you're involved in the CEPN. In South London, we launched the CEPN programme in 2013 with a prototype phase where we invited interested parties to submit to us ideas about how they might deliver education and training outside of hospitals based around the principles that Sanjeev outlined earlier. Off the back of that, we funded 4 small projects and 4 months in did a rapid evaluation and pulled out some key design principles which we felt were important for making the idea work. And off the back of those design principles, we hosted a launch event in December 2014, inviting expressions of interest from local providers around creating community education provider networks. So that was really when we solidified this idea that they should be based around geographically discrete areas focused around those population health needs. As I said, that was December 2014. We had initially 7 expressions of interest from areas across South London, and the first round of funding for these new geographically focused networks went out in the summer of 2014. We are now in a position to say that we have a network in development in each of our boroughs in South London. The final plan for a CEPN to be developed was just signed off this month. So we now have 12 networks in development covering all of South London. And also just want to say, as Sanjeev mentioned, we are starting to see some really innovative practice coming out of these networks across the patch, doing a huge amount of work, particularly around undergraduate nurse placements and postgraduate nurse placements for general practice nursing, as well as new innovative pathways for nursing in community settings, and also around undergraduate medical students, which we're just starting to work on now.
The inspiration behind setting up a CEPN is really just to ensure that we really think very hard about developing a workforce based around the needs of a population, particularly as our population is getting older and some of the demographics are starting to change, and also as service models are starting to change with much more care being provided out of hospitals. We need to think of an alternative to training in a hospital for a hospital, which is what a community education provider network is meant to do. So what's involved in setting up a CEPN if you're doing it from scratch is really to bring together a network of providers around a common purpose. And the common purpose in this case is workforce development, education and training. That's important because in order to create networks and potential federations, you really need to have a clear purpose identified as to why people are doing that. So the first step is to think about the purpose, in this case workforce development, education training, and then to establish a network based around that purpose.
Okay, well, when they first came across the terminology of CEPN, I had no idea what they were talking about, and I thought, well, another acronym, well, how am I going to deal with this? But when I thought it through and had looked at some of the original papers, I thought, wow, this is a really good idea. For me, it felt like this gives us the opportunity within primary care to develop a workforce in the way that we feel that we need to develop them. And I guess when I'm looking at, I'm a nurse by background, and when I'm looking for courses for nurses in primary care, I look to our the universities locally, and I think they're sending out courses which are totally inappropriate to what we need to deliver our patients' needs. So we've got patients with long-term conditions, for example, dementia or whatever, and it's real kind of basic care, but it's a generalist care. And so we need courses that are actually people that will equip people with the skills to deliver the right care in the right place. And I thought this is a great opportunity for me to be involved in this, thinking that if I know best, which I guess I've been around, I've been a nurse a long time, I've been in general practice a long time, and I think I've got an idea, and that's my kind of clinical expertise to say this is what I think we should be doing for patients. This is hearing what patients are saying and thinking this is how we should deliver that need. So the CEPN then, for me then what it was meaning was like, okay, well this is like a little laboratory within primary care, so this is our university within the community.
Well, I was first approached about the idea of community education provider networks something like 2.5–3 years ago, before they had been developed by Health Education South London, by two GP colleagues who had really invested a lot of thought into how to improve the infrastructure of education in the community to meet the needs of community and primary care. The principal at St George's and I were enthusiastic about the idea at the time, and as time has moved on, community education provider networks have become a reality, and they provide a fantastic opportunity for an understanding of workforce needs, training needs, much closer to the ground than we've had previously, and the infrastructure as they go forward to deliver the education that's needed for the modern NHS workforce in the community. My role has been to support the CEPNs in South West London from the university perspective. So I chair the delivery board, and I work with a project manager who supports the local CEPNs develop, and we're currently working with them to provide academic liaison and financial support in relation to the delivery of their funds from HESL.